Naval Health Clinic has been part of the kind of footsteps of Charleston. We've been here since the 1900s. We've just morphed over time, become more advanced, and continue to provide the care to the community, and we love doing it.
Well, it's a staple that's been in Charleston for more than a century, and while it has had several locations, the Charleston Naval Health Clinic just cut the ribbon on its facility after a 5-year, $25 million renovation project. I was invited out to the naval base and want to introduce you to the amazing men and women running the health clinic, as they are Live 5's Squadron of the Month. In 1902, the Tent Hospital at the Navy Shipyard opened its doors in the Charleston community and has a rich history. It operated as a 1,000-bed emergency hospital during World War I. It dropped to a much lower capacity in 1922 for about 2 decades, but then ramped back up during World War II. The naval base and shipyard closed in 1996, but in 2007, the Naval Health Clinic Charleston officially moved to the Naval Weapons Station and hadn't undergone renovations since 2010 until now.
There were some vulnerabilities as far as the windows and the ceiling and things like that. And so over time, we had a lot of just leakage. We had a lot of just issues with water intrusion to our facility. So major effort, multiple stakeholders, lots of just great cooperation by our staff, like a chessboard, moving offices. But happy to report, yeah, this month we'll be finished with this 5-year evolution. It's going to make our clinic that much better, more hurricane resistant, more water resistant, just a better place to work.
The role of those at the Naval Health Clinic is medical readiness.
Medical readiness is all about my ability to go anywhere, anytime, any place, ready to fight tonight. To be ready to fight tonight, that means if I go anywhere in this world, I don't want to be battling toothaches. I don't want to be battling any health injuries that are going to prevent me from doing my wartime specialty. And so what medical readiness means is taking care of mind, body, and soul.
There are about 300 people employed at the Naval Health Clinic, about 100 military, about 175 civilian, and then a smattering of contractors, all providing care to about 18,000 active duty personnel, dependents, and veterans.
It's been a fight for manpower, but in a good way. You know, we're trying to ensure that we're supporting the fleet and all the ships have the manpower they need. So we're pushing a lot of people forward to be able to fill that mission. So for us here left on the CONUS side, you know, CONUS meaning Continuous United States, and these small little clinics to ensure that we can continue the mission with the manpower we have.
Their patients include those at Joint Base Charleston and the students at the Naval Nuclear Power Training Command.
Lots of moving pieces, as you know, at all times. So I think it's our day-to-day operations and making sure we get enough of our training in there, enough for the development of the sailors, as well as meeting our mission, taking care of our sailors and our patients, especially the nuclear pipeline across the street. So we have nuke students. Right now, it's the only Navy nuclear pipeline school. So they all come through Charleston. And when they graduate in about 2 years, they head to aircraft carriers and submarines out in the fleet. So fleet concentration development for those sailors across the street. And we're here to provide that medical support.
And with all of that care also comes a lot of prescriptions. The Naval Health Clinic runs one of the largest pharmacies in the greater Charleston area.
Here at the pharmacy, we fill roughly around 1,000 prescriptions daily. I'm also in charge of executing $7 million budget for the inpatient, outpatient medications in the clinic. We support the nuclear community, the fleet, retirees, and beneficiaries.
Over the past year, they also implemented a new electronic health record system, switching everyone's files over.
We have a great pharmacy department here. We work very well together, especially to support the patient population. We've overcame a lot of obstacles.
And then there's something you might not think about. There's also a public health department, which tests water, is in charge of a mosquito abatement program, and makes sure that the barracks and habitability programs for all of the structures on base are within livable conditions.
We have our water testing sampling kit, right? We have all our different samples, how we can test for hardness, pH, our bacteria that we put into the samples to see if it grows within our incubators. So we keep all our water stuff over here. Here we have one of our freezers. Here on the wall we have our mosquito traps, and what we do is we put dry ice in them. It creates a lot of CO2. Mosquitoes like CO2, and they have fans, and it sucks them up, and then they freeze. And they're trapped in there, and then we go ahead and we count them and report that over to the Air Force to make sure that their spraying program is killing the mosquitoes that we want them to kill in the right amount of number.
Now, are you putting this bottom part physically in the ground or in water, or where?
Yeah, we're putting it on the ground, and we Sometimes we hang them, right? And we collect them the next morning. So we'll go out throughout the entire base, and we'll go in our vehicles and we'll place them, and we'll come back the next morning to see what we've collected.
How many would you say you typically collect in a single outing?
Maybe a few hundred.
Okay. And while a lot of the services at the Naval Health Clinic are preventative care, there are opportunities for servicemen and women to learn more.
To go work in the Trauma One Hospital Center, and it's with civilians, so I was able to work in wake medicine in Raleigh, North Carolina. You get to see patients that you won't see day to day here, anything from gunshot wounds victims, motor vehicle accidents, domestic violence even, and it was honestly probably one of the best experiences I've had in the military.
Do you think that really prepared you for anything that you could take on a day-to-day even here?
Yes, ma'am. So when you go out to an operation, you might see gunshot wound victims, you might see motor vehicle accidents. So I'm happy that when I do go on to the next platform, which I will be doing here shortly, it won't be the first time I've seen something like that. So I don't have that shock effect of, oh, what do I do?
And how did you get selected for that training? Is it something you had to apply for?
Yes, ma'am, I did. I put in an application with about 15 to 20 other applicants.
Very cool. And how many were accepted?
About a quarter of that.
Okay. So that's a big honor for you.
Yes, ma'am, absolutely.
That's awesome. Well, in addition to getting all health records online, the Naval Health Clinic is expanding their telemedicine program and making sure that everyone has access to mental health care.